I did a study with Professor Paul Larson, and we showed that 91% of American adults were over fat. They had excess body fat that impaired their health and fitness. That's how I define
Absolutely. Even
the
skinny fat people.
Yeah, whoever they are. And it's interesting because even people who have a normal weight, so-called normal weight, and are not obese, 30% of them also are over fat. So we don't want to use obesity because it's an outdated measure and it doesn't really pertain to body fat and all kinds of other reasons which have become outdated. But that in itself, 91, so that would mean 91% of Americans are insulin resistant, which is sort of like a pre-diabetes, but that insulin resistance that promotes excess body fat now trickles down to create injuries, physical injuries, biochemical injuries, mental, emotional injuries, and chronic diseases, cancer, heart disease, diabetes, Alzheimer's. So when you're concerned about these diseases, and when you're concerned about the injuries, you need to just keep looking at what's causing it. And body fat is a very, very significant reason why these things are occurring. And then the question is, where does the excess body fat come from? It comes from excess sugar intake, excess carbohydrate intake, sugar intake. So if we really want to treat the cause and not the symptom, obviously we eliminate junk food, we eliminate refined carbohydrates.
Yeah, simple. And this is some hormonal stuff that listeners should be aware of. And like when I work with clients now, I make sure that they insist when they do blood work that they have to insist and they have to push back against their PCP or whoever's doing the blood work. But I insist that besides the standard panel, the standard lipid panel, they always get a 25 hydroxyvitamin D and a fasting insulin. When you look at the medical reference range for vitamin D, the low end is in the deficient level. For me, anything 40 and below is deficient, 40 to 50 is suboptimal. You need to get above 50 or above. And the recent literature on COVID showed that people with 50 or above didn't have bad COVID infections. And then on the insulin, same thing. The medical reference range starts at, I think it's been lowered down to some reference ranges are down to 15 or 12. Most of them are up in the 20s. That's the bottom of the insulin reference range. And I'm like, ideally, you want to be between 2 and 6, and you can drift between 8 and 12. But once you get to 12 or above, you're starting to have metabolic derangement, or you're getting compromised. And you're talking about right now, if you got pre-diabetes, let's just be plain. You've got diabetes. It's just the most reversible part of it.
It is. It's reversible more so early on, but still diabetics who've been diabetic for a long time and taking insulin, type 2s, you can get them off insulin quite easy if they're willing to do it. There's some discipline involved, and there's a difficult transition because they're addicted to sugar. They're just feeding their sugar habit with the dose of insulin they need, and not the other way around. But I would add to that blood panel, and it's often done, but it's often not looked at, the fasting triglyceride.
That's part of the standard lipid panel.
Yeah, and so you need to look at the triglyceride and you need to look at the HDL cholesterol, and together they represent the key to all of the cholesterol sugar connections that exist out there, and most practitioners don't look at that.
110%, because that's why I have them do the 25 hydroxyvitamin D and the fasting insulin, because when you take triglycerides, vitamin D, and fasting insulin, and look at the LDL and the HDL panel and it's context. Context matters. And if your triglycerides are high and your vitamin D and your insulin's high, above 12, not reference range, and your vitamin D is low, which actually represents most of America.
Yep.
You're on your road to cardiovascular disease or diabetes or something.
Among other
However,
things.
However, what we're finding, and this was shown in the FASTER study on the second paper that came out, if your triglycerides are low, 90 or below, ideally in the 60s or 70s, but your vitamin D is 50 or above, and your insulin is low, like 2 to 6, it's actually elevated LDL is actually a sign of superior health.
It is, and this is what people are still stuck on. We've all grown up around these myths about, in the beginning it was total cholesterol. You shouldn't be over 200, and and all that came from the low fat trend. But the cholesterol, then it was the LDL, and then it was the LDL particle size, and then it was blah blah blah, just a bunch of crap that just was not scientifically sound. And finally, we've got to the point where we've got some really good numbers we can look at, the triglycerides and the HDL, for example, if we want to know our cardiovascular health. And nobody's doing it yet. I shouldn't say nobody, but a lot of people in healthcare and a lot of the patients who have to educate themselves need to understand how important these numbers are. It's really, really quite simple.